as we continue the external iliac artery and vein past the inguinal ligament, again, once we're in the leg, we call them the femoral artery and vein. Okay, now let's take a look in this arm model. Okay, so the ribs would be over here somewhere. So since we're past the ribs, we're really picking it up with the axillary artery. It would continue to be the axillary artery until around here, where we're getting really into the diaphysis of the humerus, and then the name would change to brachial artery. Okay, and where we can see well for identification again is here. Again, here is in the forearm for the next two. So on the thumb side, we'd have the radial artery, and on the pinky side, much smaller, we'd have the ulnar artery. So that size difference that you can see is one of the reasons that you take a radial pulse and not an ulnar pulse. As we look at the leg, we're past the inguinal ligament that we talked about. So we're starting with the femoral artery and vein. We're going to remove the sartorius here. Okay, and as we remove that, we can see the femoral artery passing into that adductor hiatus that we talked about earlier. The vein is in there as well. And they won't come out until they get to the posterior knee. So let's move the hamstrings here. And there they are. Okay, so once we're in the posterior knee, again, the name changes. So this would be the popliteal artery, where you take a popliteal pulse. Okay, and the popliteal vein. And then the popliteal artery, as it proceeds along, is going to split into two divisions. The one that stays posterior is the posterior tibial branch. The one that curves anteriorly, and we can see it on this model, is the anterior tibial branch. One quick look at the heart again. Remind ourselves about some of the vessels, and then we'll look at the structures that were left over from the fetus. So we have the ascending aorta, aortic arch, descending aorta, which will become the thoracic aorta, and then we have the brachiocephalic artery, left common carotid artery, left subclavian artery. Okay, this white structure in between, remember, was the ligamentum arteriosum, which was a remnant of a fetal structure. The fetal structure that is a remnant of, we can see on this fetal heart. Okay, so here's the pulmonary trunk. Here's the descending aorta. And you can see that they are interconnected by this vascular structure here. And this is the ductus arteriosus. Okay, so the ductus arteriosus connects the pulmonary trunk to the aorta so that blood can bypass the lungs. Okay. Now if we open up the heart, we can see the other important fetal structure. And that is the foramen ovale. And I'm putting the probe right into it. Okay, so the foramen ovale is an opening that connects the right atrium to the left atrium. You can see a good shot of the opening there. And that allows blood to bypass the right ventricle. Now you might be wondering why you would want deoxygenated blood to bypass the lungs, but remember, this is a fetal heart, So the gas exchange is actually happening at the placenta. And you'll see that the superior vena cava here is labeled as blue. But if we look at the inferior vena cava, aha, it's red. That means oxygenated blood is coming through here. Okay, so we're giving the oxygenated blood, and that's what this red wire is trying to depict here, a quick way to get to the left side of the heart so it can be sent out to the body. And what little blood gets into the right ventricle and doesn't get through the foramen here is going to get shunted through the ductus arteriosus to the aorta to move out into the body.